Come in.
All right. I'm going to provide some privacy. Hi, how are you?
Good. How you doing?
Good. I'm Samantha. I'm your nurse today.
Hey.
Would you be able to put down your phone for a little bit just to talk about this information?
Yeah.
Okay, great. Thank you. Can I get your name and date of birth?
Miss Bronchi, August 20th, 2003.
Okay. You must be mom?
Yes, I am.
All right. Hi, how are you?
Hello.
Good. So you are prescribed albuterol, also known as Proventil.
Okay.
So it's for your new diagnosis of mild persistent asthma. So the long-term goal for this drug is to clear out or reduce the to demonstrate absence or reduction of congestion with breath sounds that are going to remain clear and your respirations that are going to remain noiseless. Okay, so reduce the wheezing and the airway.
Okay.
So we just want to clear out the airway. Okay.
Okay.
So your diagnosis for me personally would be considered ineffective airway clearance related to asthma, and it's as manifested by, so as evidence shown by your cough, shortness of breath, and your history of allergies. Seasonal allergies definitely have an effect on that as well. Okay. So by the end of today, I do want to instruct and I want you to demonstrate back by the end of the visit that the coughing exercises I plan on teaching you.
Okay.
I also want to be instructed. I want to instruct on the breathing exercises. Those two just promote drainage and your respirations and clearing out those airways.
Okay.
I also want to demonstrate and instruct on how to use the inhaler properly.
Okay.
Just so when you're home alone, you guys can do that. Okay.
Okay.
All right.
I saw something online about it, but
Yeah, I know. So usually they're I know I was told that you didn't really want to learn about it too much, but there's also a toll-free online website, okay, that you be able to ask questions on 24/7 in case our office isn't answered for any questions or concerns that you have that I can't answer today. Okay. So your dose today is being recommended as 2 puffs a day, 4 times daily. Okay. So usually I know the biggest issue you said that was that you can use this whenever you want. Mm-hmm. So whenever you're short of breath, you can use this drug. Technically, no. So the recommended dose, you always want to do, if you're being told 4 times daily, you want to do 4 times daily. If you do it more, it'll increase the factors of paradoxal bronchospasms, which is wheezing, and it concurs into like multiple other things. Okay, so it's pretty serious, so you don't want to. Some other side effects would be considered palpitations and chest pain, which with your heart murmur already, I would definitely notify the doctor if that persists, just because that can increase the effects of your heart problem as well. Okay. Other things that the side effects can be included are restlessness and nervousness, which those deep breathing exercises will definitely help with, and chest pain, diarrhea. I'm sorry, I already said chest pain, but diarrhea and any like stomach aches. You can always just take this with your meals and increase your fluids to make sure it doesn't hurt you as much. Okay. So usually this is contraindicated with you would want to watch your intake of caffeine and tea. I know, it stinks, but it usually increases the effects of the drug, and that's not good, okay? And then any other adrenergic drugs. So since this drug is a beta-2 adrenergic receptor, so it just is a bronchodilator to promote that airway, you want to make sure you're not using any other drugs like that, just because it'll increase the effects of that, okay? All right. To take this drug, you would always want to shake the inhaler really well to make sure you have all the medication properly in, and then you administer it into the aerospace chamber. Okay. And then you would be able to promote, after you press onto the inhaler, you promote all the medication and air through the chamber, and you put your mouth on here. Okay. Does that make sense?
So she always used that chamber.
You always use the chamber. You don't want to use just this because it promotes more medication to be through the lungs.
Okay.
And that's really good.
I'm going to shake it first.
Yeah, so you shake it really well, and then you always want to do 1 minute between each inhalation.
Oh, okay.
So, okay. You usually want to make sure you avoid that drug within having it in the sunlight, and you want to make it in a room temperature room, just so it doesn't have below freezing temperatures or super hot. It'll affect the drug. Okay? And you can also rinse and spit between each use, just so it doesn't have that bad aftertaste afterwards. Okay. Any questions?
I don't think so.